Why do millions in India still struggle to access basic healthcare services? In the heart of a rapidly developing nation, the healthcare system tells a story of stark contrasts. Despite strides in technology and economy, India's healthcare infrastructure remains critically underfunded and understaffed. The country grapples with a severe shortage of healthcare professionals with only one doctor per 1,000 people, a figure that underscores the urgency of the situation. The disparity is more pronounced when considering the rural-urban divide. Urban areas with better hospital facilities and more healthcare practitioners starkly contrast with rural regions where residents often travel great distances for basic medical services. Many of these areas lack sufficient hospitals, and the ones that exist are frequently overwhelmed and under-equipped. Moreover, the accessibility to healthcare is hampered not just by physical distance, but also by economic barriers, leaving the most vulnerable populations at a disadvantage. This gap in healthcare services raises a crucial question. What can be done to improve the situation? Consider two worlds within one country: urban centers with advanced clinics versus rural areas where hospitals are few and far between. In cities like Mumbai and Delhi, hospitals are equipped with state-of-the-art technology and staffed by specialists in every field. These facilities not only offer a wide range of services, but also serve as teaching centers for future healthcare professionals. Contrast this with a village in rural Bihar or Odisha, where the nearest healthcare facility might be miles away, often accessible only by rough roads. Here, the local clinics struggle with understocking of essential medicines and a chronic shortage of qualified staff. For instance, while an urban hospital might boast a ratio of 1 doctor per 500 patients, rural areas often see this ratio dilate to 1 doctor per several thousand. This disparity highlights not just a lack of resources, but also a gap in healthcare delivery, which affects the quality of life and survival rates in rural populations. Clearly, bridging this urban-rural divide is essential for equitable healthcare. Imagine a healthcare system in India where technology and innovation pave the way for universal access to medical care. Envision telemedicine platforms connecting patients in remote villages with specialists in bustling cities, overcoming geographical barriers that once seemed insurmountable. Mobile health units could traverse rural landscapes, bringing essential services like vaccinations, prenatal care and disease screening directly to people's doorsteps. The potential for improvement hinges not only on technological advances but also on robust government policies. Increasing healthcare spending is vital. Consider the success of countries that have integrated technology into their healthcare systems effectively. These nations have seen significant improvements in patient outcomes and reductions in healthcare costs, proving that strategic investment in health can yield substantial benefits. Moreover, fostering partnerships between the public and private sectors could accelerate the deployment of innovative solutions, ensuring that advancements are not only achieved, but are sustainable and scalable. With the right innovations, the dream of accessible healthcare for all could become a reality. What roles should the government and private sector play in reshaping India's healthcare landscape? In the tapestry of India's healthcare, the government's primary role is regulation and funding. It's tasked with ensuring that healthcare policies are equitable and reach the farthest corners of the nation. This involves not only the creation of robust healthcare laws, but also the allocation of sufficient funds to support public health initiatives and infrastructure. Meanwhile, the private sector holds significant potential in revolutionizing healthcare delivery. With its capability for rapid deployment and innovation, the private sector can efficiently manage healthcare facilities and introduce cutting-edge technologies. However, the challenge lies in making these advancements accessible and affordable to all layers of society. The synergy between these two sectors can be greatly enhanced through public-private partnerships. These collaborations can leverage the strengths of both sectors, from funding and strategic planning by the government to efficiency and innovation from the private sector. Engaging community groups in these partnerships also ensures that the solutions are tailored to the unique needs of different populations. A collaborative approach could be the key to transforming healthcare in India. We've explored the challenges and envisioned the solutions, but how do we turn these ideas into action? In our journey through the landscape of India's healthcare, we've seen the stark contrast between urban facilities brimming with technology and rural areas where basic medical care is a luxury. The disparity is not just alarming, it's a call for urgent rectification. Innovations like mobile health units and telemedicine are promising, yet they require robust support and widespread implementation to truly transform lives. The government's role is pivotal, steering policies and funds towards infrastructure and accessibility. Equally, the private sector's innovative prowess and resources can bridge critical gaps. However, the most potent force for change is the collective will of the people. Public awareness and participation can drive accountability and ensure that proposed improvements are not just plans on paper. Let us be the change. Engage, discuss and demand better healthcare. Because improving healthcare in India is not just a necessity, but a duty we owe to future generations. It's time for action.